Did you know 800,000 Americans die each year of clogged arteries, and 500,000 are sudden deaths with no prior warnings? Look at this severely clogged artery. Life-sustaining blood cannot get through. You'd expect a heart attack or stroke here, but surprisingly, more heart attacks and strokes occur each year from partially clogged arteries, just like this one. And you can have arteries that look like this in your 40s, 50s, and 60s. This is why we're seeing so many sudden deaths from heart attacks and strokes with no prior symptoms or warnings. The fact is, arterial plaque hardens over time, and then it can rupture, sending a blood clot rushing through your bloodstream. Now, if that blood clot blocks one of the narrowed arteries that feed your heart or brain, you could have a fatal heart attack or stroke. But here's good news. Today, we have America's foremost authority on heart health, Dr. Chauncey Crandal, to give us a presentation on how to stop, reverse, and cure clogged arteries naturally without drugs or surgery. Dr. Crandal is the Director of Preventive Medicine at the world-renowned Palm Beach Cardiovascular Clinic in Palm Beach, Florida. He treats some of America's most influential leaders, as well as everyday folks, from carpenters to plumbers. And he's on call as an emergency heart surgeon at 3 South Florida hospitals. Today, Dr. Crandal will show you 4 things. 1, how arterial plaque causes heart attacks and strokes, not just in the elderly, but in the young and middle-aged too. 2, how arterial plaque gets started, progresses, and why it becomes dangerous as it hardens. 3, how to find out how much plaque you have in your arteries right now and whether or not it's hardened. And most important, 4, how to stop and reverse your clogged arteries without surgery so that you won't be a victim of heart attack or stroke. Dr. Crandal's presentation will take just a few minutes, but what you discover could literally save your life. Here is Dr. Crandal.
Hi, I'm Dr. Chauncey Crandal. As an interventional cardiologist, I've dedicated my life to saving lives. One of the most difficult things I face as a doctor is seeing people die of a heart attack or stroke when I know it didn't have to happen. That's why I write a monthly newsletter, Heart Health Report, and also give these online presentations on how to prevent and reverse coronary arterial disease. Today I want to talk to you about plaque, the fatty substance that clogs your arteries. If you're over age 30, you may already have it, and by age 50, it can be significantly advanced. That's why it's important to find out how much plaque is clogging your arteries right now, because if you let it build up too thick or calcify and harden, it can suddenly kill or debilitate you. That's what happened to James Gandolfini at age 51, Tim Russert at age 59, and John Candy at age 43. Those were well-known celebrities who generated big headlines. What's much less known is that in America, clogged arteries cause 1.5 million heart attacks and strokes per year, 800,000 deaths per year, and 500,000 sudden deaths with no prior warnings. Yes, 500,000 sudden deaths with no warning at all. And most of these fatal heart attacks and strokes were not from badly clogged arteries, but just partially clogged arteries in which the plaque ruptured. Why risk it when today's modern tests can tell you how much arterial plaque you have, and then it's fairly easy to stop, reverse, and cure it? Let me show you how, and let's start with the basics. Commonly, we call clogged arteries heart disease, or more inclusively, coronary artery disease, because the clogging process occurs in arteries throughout your body. Doctors call this disease atherosclerosis. Atherosclerosis is the buildup of fatty plaque on arterial walls that narrows your arteries and restricts or even blocks the flow of life-sustaining blood to your heart, your brain, and other vital organs. Contrary to what most people believe, this buildup of plaque starts not in middle age, but as early as childhood. In fact, a recent study by Northwestern University Medical School revealed that today's teens, because of our modern diet, already have arterial plaque, and it is building up at faster rates than ever before. It's important to understand that atherosclerosis is a lifelong process with plaque building up over the years slowly, steadily, and silently. But here's where the problem becomes serious. Over time, arterial plaque calcifies and hardens, and if hardened plaque ruptures, one of three things will happen. 1, you'll have a heart attack. 2, you'll have a stroke. 3, you'll need a painful and risky surgery. Any one of these events can kill you, and even if you survive, your quality of life could be severely diminished. A stroke can put you in a wheelchair and take away your speech. A heart attack can damage your heart and leave you at risk for an early death. Surgical procedures, of course, have risks and post-operative complications. 4 of every 10 women, for instance, die within 1 year of their first heart attack. I've got a better idea. Let's avoid these problems altogether by getting to the bottom of what actually causes clogged arteries and learning how to stop, reverse, and cure this condition. Frankly, what I have to tell you is coming none too soon because atherosclerosis is by far the #1 killer in America. And what's most troubling is that with each passing decade, people are dying earlier from it. Why is that? Because our modern Western diet contains way too much sugar, too many bad fats, and chemical food additives that create inflammation. As you'll see in a moment, this can be a deadly combination. Okay, what about cholesterol? Isn't that the biggest contributor to coronary artery disease? And aren't you safe if you're taking a cholesterol-lowering drug? No. While it's true that cholesterol is at the scene of the crime of clogged arteries, it is not the cause of coronary artery disease. What's more, just taking a cholesterol-lowering statin drug and thinking you're protected against a heart attack or stroke is dangerously naive. Here's the proof. Over half of all fatal heart attacks and strokes occur in people who have cholesterol readings in what is considered the normal range. What's more, a recent analysis of 14 trials involving over 90,000 patients taking statin drugs reported an average of just 3 in 200 patients realizing a benefit. The rest did not live longer, nor did the drug reduce the risk of dying from coronary artery disease. Cholesterol-lowering statin drugs can be useful on a short-term basis to bring high levels of bad cholesterol down, but they should be taken only until you bring it under control with diet and exercise. There's no good reason to take statin drugs for life, and most people should not take them in the first place, certainly not as the only method of prevention. And so, today I want to show you how arterial plaque gets started and why, how it progresses and what makes it worse, how to find out how much plaque is in your arteries right now, and most important, how to stop, reverse, and cure clogged arteries so you won't be a heart attack or stroke victim or need a risky and painful surgical procedure. Getting these facts right now is urgently important when you consider that 500,000 people are dying suddenly each year with no warning. The good news is that when you do just a few smart things to reverse coronary artery disease, things I'll show you today, you'll not only stop the clogging process, but you'll protect yourself from arthritis, diabetes, and cancer too. That's because the same things that cause coronary artery disease also cause those other degenerative diseases. Okay, let me again emphasize that coronary artery disease starts at very young age and then steadily builds up over the years. By the time you reach your 40s, 50s, and 60s, you can have 30, 40, even 50% plaque clogging your arteries. I'll tell you why that's a major risk just ahead.
Hi. We'll get back to Dr. Crandal's presentation in half a minute, but I want to make sure that you caught a very important point. Coronary artery disease, which is the process of fatty plaque building up inside your arteries, starts as early as childhood and steadily progresses over the years. This is not something that happens in old age, and most people are at risk for heart attacks and strokes at much younger ages than they think. Fortunately, Dr. Crandal will show you why this happens and how to stop and reverse it. And he'll also tell you about the tests you can get from your doctor to learn how much plaque is clogging your arteries right now. But I want you to know you don't have to take notes during Dr. Crandal's presentation. In just a few minutes, you'll get a special offer that includes free copies of his best-selling book, The Simple Heart Cure, and 3 of his life-saving reports: Sudden Cardiac Death, Don't Be a Victim, What You Must Do to Prevent Strokes, and Alternative Treatments to Protect Your Heart Without Drugs. Everything he's covering today and much more is in his book and these special reports. So you can have all of this valuable information at home for handy reference. Okay, now let's get back to Dr. Crandal.
Okay, why are partially clogged arteries a major risk factor for heart attack and stroke? For one thing, if your plaque is blocking less than 75 or 80% of blood flow, you'll feel nothing. You won't know anything is wrong. But even much less plaque can be dangerous because over time, plaque calcifies and hardens. If it ruptures, it'll send a blood clot rushing towards one of the narrowed arteries that feeds your heart or brain. That's what causes a sudden heart attack or stroke, either of which can kill or debilitate you. You see, your arteries do not have to be fully clogged to create a fatal or debilitating heart attack or stroke. In fact, most heart attacks and strokes occur not from completely clogged arteries, but from ruptured plaque that has calcified and hardened. That means the plaque you have in your arteries right now, even though it may not be restricting blood flow, can be dangerous to your health. That's why I'd like you to read my special reports: Sudden Cardiac Death, Don't Be a Victim, What You Must Do to Prevent a Stroke, Alternative Treatments to Protect Your Heart Without Drugs. In my book, The Simple Heart Cure, I'll show you how to eliminate coronary arterial disease from your life altogether, and in the process, help prevent arthritis, diabetes, and cancer. But with 500,000 sudden deaths per year, I urge you to get the reversal process started today. So let me show you: 1, how arterial plaque gets started; 2, why it progresses and then calcifies and hardens; and 3, and most important, how to reverse it. To fully understand the process, we need to briefly discuss cholesterol. Again, let me make clear that while cholesterol is concentrated in the fatty plaque that clogs your arteries, it is not what causes the disease. And let's get this straight right now. Cholesterol is not your enemy. On the contrary, cholesterol is vitally important to your health. Your body makes about 75% of your cholesterol, which serves several important functions. Cholesterol is an important structural component of every cell in your body. It plays a key role in making your hormones. It's essential to the digestion of your food. It helps make vitamin D, which not only protects you against serious diseases such as cancer, but makes your teeth and bones stronger. And most important, it plays a vital role in your immune system response. Without cholesterol, you would get sick and die. So why is cholesterol concentrated in arterial plaque and always mentioned in conjunction with coronary arterial disease? Well, for one thing, cholesterol is in every cell of your body. So there's nothing unusual about its presence in arterial plaque. But more accurately, cholesterol is concentrated in the fatty plaque because it's a key component of your immune system response. What's happening is your immune system is trying to heal a wound on your arterial wall. But under certain circumstances, which I will illustrate shortly, this healing process becomes distorted. Okay, but what actually gets the artery clogging process started? I'll tell you after this short break.
We'll get right back to Dr. Crandal in half a minute, and he'll show you exactly how the artery clogging process gets started and how you can stop it. But right now, I want to make sure that you caught a very important point. Cholesterol is not your enemy. According to Dr. Crandal, cholesterol is vital to your health, making hormones, helping with digestion, strengthening your bones and teeth, and playing a key role in your immune system response. Sadly, we have all been misled by the media and the pharmaceutical industry that cholesterol is the cause of coronary artery disease. But today, you're discovering what really causes coronary artery disease directly from America's top heart doctor. Dr. Crandal is the editor of the very popular monthly advisory letter, Heart Health Report, in which he shows his readers how to keep their arteries clean and their hearts healthy. And these simple practices also greatly reduce the risks for arthritis, diabetes, intestinal disorders, and cancer. Now, here's good news. Just ahead, I'm going to show you a special offer that will allow you to try Heart Health Report completely risk-free for just 15 cents a day. And this offer includes free copies of Dr. Crandal's book, The Simple Heart Cure, and his 3 reports, Sudden Cardiac Death, Don't Be a Victim, What You Must Do to Prevent a Stroke, and Alternative Treatments to Protect Your Heart Without Drugs. I'll tell you more about this great offer just ahead, but first, let's get back to Dr. Crandal and see what really causes coronary artery disease.
Okay, what actually gets the artery clogging process started? There are 2 main culprits. 1, sugars, and 2, bad fats. These combine to create too much fat in your bloodstream, which then sets the stage for the buildup of arterial plaque, but only under certain conditions, which we'll discuss in a moment. When you understand that sugars and bad fats are the main culprits, it's easy to see why 800,000 people die from coronary arterial disease each year, and 500,000 of those are sudden deaths. Sadly, the standard American diet is loaded with sugars and bad fats, and that's not all. When we eat processed foods, which typically come in cartons, cans, boxes, and bags, we not only get lots of sugar and bad fats, but also chemical additives, and all of these things increase inflammation in your body. Now pay attention here, because this is important. Inflammation is the primary driver of heart disease, as it is with all degenerative diseases. So, in a nutshell, inflammation combined with too much fat in the blood is what causes coronary arterial disease. And these additional things fuel it: stress, high blood pressure, smoking, lack of exercise, hormonal imbalances, overproduction of insulin because of high blood sugar, too much overall body inflammation, even if that inflammation is from arthritis or an infection. The good news is that if you follow my guidance in my book, The Simple Heart Cure, and also in my special reports, you can easily stop and reverse this condition. Imagine living a life free of heart disease with no need to take cholesterol-lowering drugs or even blood pressure medication. Imagine dropping those excess pounds, having more energy, looking years younger, and enjoying peace of mind too, because you'll have a much lower risk for arthritis, diabetes, and cancer. In other words, when you get your arteries and heart healthy, you'll get your whole body healthy. Okay, now let me show you what to do about plaque. I'm going to show you some tests that will tell you how much plaque you have right now, if that plaque is soft or hard, and also if the buildup is progressing and you're at risk of a heart attack or stroke. We have excellent tests for this today, so there's no need to be in the dark about it. But frankly, you should expect to have some plaque. You've probably been building up plaque in your arteries over the years. Virtually everyone has, and it could lead to danger. Fortunately, we can fix this. So let's see what causes plaque to start building up in your arteries, and then you'll see how to reverse it. You'll recall that earlier I mentioned that cholesterol is important to your immune system response, but under certain circumstances, your immune system works against you and actually creates arterial plaque. Let's see why and how this happens. You probably already know that cholesterol is comprised of two types, the so-called good HDL cholesterol and the so-called bad LDL cholesterol. Now, the bad LDL cholesterol comes in two types, the large buoyant pattern A particle and the small dense pattern B particle. And here's the important part. The bad LDL cholesterol is only really bad if it's the small dense type or pattern B. And even then, only if you're also doing things that actually cause heart disease. Do you know whether your LDL cholesterol is comprised mostly of pattern A or pattern B particles? Most people don't, because their doctors don't test for this unless you specifically ask for this test. You may start with a total cholesterol level of 220, and by taking a statin drug, get this reading down to 180, and then you probably think you're safe, but that's just not true. I have a chapter in my book, The Simple Heart Cure, that's titled Must-Have Heart Tests. One of these tests is to get a complete blood panel that shows all of the lipid components and their counts. You see, just knowing your total cholesterol number is meaningless without details about your HDL, your LDL, and whether you have mostly type A or type B LDL particles. You'll also want the test for C-reactive protein, which is a marker for inflammation. Remember that coronary arterial disease is caused by too much fat in the blood and inflammation. The fact is, you can have high cholesterol and never have a problem with coronary artery disease if, 1, your HDL is high relative to your LDL, 2, you have mostly pattern A LDL particles, 3, your inflammation is low. That's why there are plenty of little old ladies in their 90s who have very high total cholesterol readings, sometimes as high as 300, and they still have relatively clean arteries. On the other hand, you can have a fairly low total cholesterol reading and have a fatal heart attack or stroke. If your LDL is the pattern B type and you're doing those things that cause coronary arterial disease, including boosting body inflammation. Let me be clear on this. The type A particles are large and buoyant and flow smoothly inside your arteries. But the type B particles are small and dense, and these have the potential to get stuck in the linings of your arteries. When the pattern B LDL particles stick to the linings of your arteries, it's like a wound that triggers an inflammatory immune response. This is what starts the artery clogging process. Okay, but why do some people have more pattern B LDL cholesterol particles? While some of this can be a genetic predisposition, a high concentration of the dangerous pattern B LDL particles typically occurs when you consume a diet high in sugars, bad fats, and processed foods with chemical additives, all of which are inflammatory. This is exactly what causes coronary arterial disease. And it will be made worse if you smoke, don't get enough exercise, are under stress, let your blood pressure rise too high, or you have hormonal imbalances such as low testosterone. The good news is that all of these things can be easily corrected, as you'll see in my book, The Simple Heart Cure. Okay, now let's look at the artery clogging process in action. I want you to see the conditions that allow small, dense, type B LDL particles to embed in the linings of your arteries, which starts the artery clogging process. Your arteries are comprised of millions of cells aligned in what cardiologists call tight junctions. But stress, hormonal imbalances, smoking, high blood pressure, or a high sugar, bad fat diet that creates inflammation can stretch and damage the arterial lining at these tight junctions. This is what opens the door to coronary artery disease by giving it a foothold. And I literally mean a foothold because the small dense pattern B LDL particles get stuck in these damaged, tight junctions. And when they do, it triggers an inflammatory immune response. This is normal because your immune system is trying to heal a wound. When pattern B LDL particles embed in the damaged junctions in your arterial wall, it's similar to getting a splinter in the skin of your finger. Typically, the surrounding area swells and turns red. That's your immune response isolating the splinter in order to expel it, which it will do in a few days. Some people do this very well, but others can't leave a splinter under their skin because it will become further inflamed and infected. The same process occurs with the embedded pattern B LDL particles in the damaged junctions of your arterial linings. Your immune system goes to work to repair the damage, but the normal immune response creates swelling and something like a blister. Some people can heal these blisters just fine, but many others don't, especially if they continue to do those things that cause coronary arterial disease. And of course, you can't dig the pattern B LDL particles out of the linings of your arteries as you would dig splinters out of your skin. So, the embedded LDL particles trigger immune response inflammation, which leads to swelling and blistering, and this swollen, rough patch attracts more pattern B LDL particles that get stuck there. This, in turn, signals the immune system to work even harder to heal the damage, and you get a vicious cycle of embedding, inflammation, more embedding, and more inflammation. This is how the plaque, which is comprised of calcium, pattern B cholesterol particles, and blood fats, steadily builds up and narrows your arteries. That, in a nutshell, is coronary artery disease. And once you start this clogging process, if you don't take steps to reverse it, it will progressively get worse. What happens next is very dangerous.
Hello again. We'll get back to Dr. Crandal in half a minute, but briefly, I want to make sure that you caught another very important point. You can get a simple blood test that will reveal not only your HDL and LDL cholesterol counts, but more importantly, if your LDL is comprised mainly of type A or type B particles. Remember, it's only the type B particles that embed in the damaged areas of your arteries, which triggers an inflammatory immune response, and that's how plaque starts to build up. Well, by getting tested for this, you may discover you have no need to take cholesterol-lowering drugs. And secondly, if you do have the type B LDL particles, Dr. Crandal will show you what you can do about it. Fortunately, there is a solution, and it's drug-free. Remember, you can receive a free copy of Dr. Crandal's best-selling book, The Simple Heart Cure, which includes the chapter Must-Have Heart Tests for Everyone Over 50, along with free copies of his 3 reports, Sudden Cardiac Death, Don't Be a Victim, What You Must Do to Prevent Stroke, and Alternative Treatments to Protect Your Heart Without Drugs. And this complete package is yours free, just for trying a no-risk subscription to Heart Health Report for 15 cents a day. This heart-saving kit includes everything in Dr. Crandal's presentation today and a whole lot more as well. Now, just ahead, you'll see a big orange button at the bottom of your screen. By clicking on that button, you can start your no-risk subscription and receive your free book and special reports. But first, let's get back to Dr. Crandal and find out how the plaque-making process turns dangerous and even deadly with just partially clogged arteries.
Okay, once you have plaque in your arteries and don't take steps to reverse it, your immune system will try to heal it by sealing the plaque formations with red blood cells, making the equivalent of a scab. This sealing process not only narrows your arteries further, cutting off the full blood flow, but the scab is essentially hard, clotted blood. This is why atherosclerosis is called hardening of the arteries. Now, a heart attack or stroke can occur from the artery eventually closing down from too much plaque. But far more commonly, it happens with hardened plaque that ruptures, sending a blood clot racing to your heart or brain. But why would the hardened plaque that stuck to your arterial walls rupture with pieces breaking free? Arteries are intended to be elastic and smooth so they can respond to your body's needs. Sometimes you need to pump blood faster, such as during exercise or stressful situations. Your arteries will expand to do this, and the blood will flow just fine if your arterial walls are clean and smooth. But a hardened artery loses its elasticity and can't stretch. High blood pressure created through narrowed arteries can cause the plaque to rupture, sending pieces of clotted blood downstream. This might happen during exercise, a strenuous task, or just from stress. The result can be a fatal heart attack or stroke. In other words, sudden death from heart attack or stroke can occur even when you have just some hardened plaque in your arteries. This is one of the most important things to understand. Your arteries do not have to be fully clogged. That's why we see 500,000 sudden deaths per year with no warnings. And that's because this disease typically starts in childhood and builds up over time, especially with our Western diet that's loaded with inflammatory sugars, bad fats, and chemical additives. Okay, so what can you do about clogged arteries? Plenty. For starters, read my reports, which will give you several specific steps to take. Sudden cardiac death. Don't be a victim. What you must do to prevent stroke. Alternative treatments to protect your heart without drugs. And in my book, The Simple Heart Cure, you'll see a chapter titled, Must Have Heart Tests. Discuss these tests with your doctor because you'll need an accurate picture of your risk for heart attack and stroke. Here are just a few of the tests you'll want to get as soon as possible. 1. An ultrasound test to determine if you have plaque in your carotid arteries that feed your brain, which is also a good indication of plaque elsewhere in your body. 2. A plaque test will show you the prevalence of an enzyme that only occurs if you are currently making plaque. This is a predictor of a future heart attack or stroke. 3. An inflammation test will indicate overall body inflammation, a key driver for coronary artery disease, as well as all of the degenerative diseases. 4, a complete lipid panel, which shows several risk factors including triglycerides, homocysteine, lipoprotein A, HDL, and LDL cholesterol levels, as well as type A and type B LDL particle counts. In my book, you'll learn all about these tests and several more that are extremely valuable in assessing your risk and heading off any potential for heart attack or stroke. It's much better to be safe than sorry. Remember, hardened plaque that ruptures is the most common cause of heart attack and stroke, and it can happen with just partially clogged arteries. Okay, I'm sure you'll like to start the reversal process right away, and that includes replacing artery clogging foods with heart-healthy foods. I know from my practice that most people are confused about this. I'm sure you know you can eat your way to coronary artery disease with a steady diet of cheeseburgers, French fries, fried chicken, and ice cream. But there are many foods that you'd never suspect as being harmful because they're billed as healthy foods. Let me show you how easily you can be fooled. Fruit-flavored yogurt is a plaque maker, even if it's low fat. Why? Because it's loaded with sugar. Read your labels and you'll see that fruit-flavored yogurt has more sugar than ice cream, typically 21 to 28 grams. The only safe yogurt is low-fat, plain Greek yogurt with a sugar level below 10 grams. How about breakfast cereals, including ones that are multigrain and high in fiber? No? Once again, almost all of these will lead to clogged arteries. Most grain cereals have sugars and bad fats in them, and frequently they have chemical additives that boost inflammation. And even low-sugar cereals are carbohydrate foods that convert to sugar inside your body. The only healthy cereal is cooked organic oatmeal. Add some blueberries and a tiny amount of raw honey for a heart-healthy meal. How about sugar-free foods? Are they healthy for your arteries and heart? Almost never. That's because they typically have bad fats in them and usually include one of the chemical sweeteners which can cause inflammation. How about the vegetable oils in your cupboard? Are they healthy for your heart? No. All vegetable oils, including soybean oil, corn oil, sunflower oil, peanut oil, canola oil, and all partially hydrogenated oils used in processed foods will make plaque because of their fat content and inflammatory effects. A common additive in packaged foods, especially carbohydrate foods, is partially hydrogenated soybean oil. Read your labels. You'll see just how common this is, and it's a plaque maker. Only olive oil and coconut oil are healthy oils. Olive oil has been part of the healthy Mediterranean diet for centuries, and coconuts have long been eaten by remote island peoples as part of their fresh food diet. Speaking of remote cultures that don't eat modern Western foods, my two passions are heart health and anthropology. I've traveled the world to study people who live in remote areas and have diets similar to the caveman diet of thousands of years ago. These people eat fresh fruits, vegetables, and wild fish and game. Heart disease, diabetes, arthritis, and cancer are virtually non-existent in these cultures, and life expectancy is often 100 years. But here in America, we grow a tremendous amount of wheat and soy, which then go into thousands of products that line grocery store shelves. And then food manufacturers add sugars, bad fats, and chemical agents to prolong shelf life, all of which boost inflammation. This is a recipe for clogging your arteries as well as creating other degenerative diseases, including arthritis, diabetes, and cancer. Okay, so what should you eat to stop or even reverse plaque buildup? In my book, The Simple Heart Cure, you'll find a chapter titled Fight Heart Disease with Dr. Crandal's Life Plan Diet. You'll get full details on heart-healthy foods, including recipe ideas. Let me give you a preview so you can get started today. Basically, you want to eat lots of fresh fruits and vegetables and a small amount of fish and chicken. You can have a little lean red meat on occasion. Cut way back on your intake of carbohydrate foods, especially white bread, white potatoes, white rice, and white pasta. You can have a little whole grain bread, not multigrain, but whole grain, but avoid covering it with sugar-laden jams and jellies. Avoid all chips, potato chips, wheat chips, corn chips, tortilla chips, rice chips, and soy chips. These foods have bad fats and inflammatory agents, and of course they are carbohydrate foods that convert to sugar inside your body. Strictly limit candies, cakes, pies, cookies, ice creams, and other sweet treats, and eat no sugar-free products containing chemical sweeteners, as these are inflammatory agents. Use olive oil and coconut oil, or real organic butter in small amounts. Do not use margarines or vegetable oils. When you make a salad of fresh greens, make a dressing with a small amount of extra virgin, cold-pressed olive oil, and fresh lemon juice, and then add a pinch of natural sea salt, not processed table salt. You can eat nuts, such as almonds and sunflower seeds, but avoid all nuts that are oily and salty. Most important, avoid fried foods, fatty cuts of meat, and processed foods that come in cans, cartons, boxes, and bags. They'll be loaded with artery-clogging fats, sugars, and chemical additives that create inflammation. Now, just ahead, I'll tell you what else you can do to dramatically cut your risk for heart attack and stroke. And I also want to tell you more about what's in my book and special reports to help you eliminate the threat of heart attack and stroke.
Hi, we'll get back to Dr. Crandal in half a minute, and we are so fortunate to get this life-saving information directly from America's top heart doctor. In his presentation today, Dr. Crandal's been clearing up a lot of the confusion surrounding coronary artery disease. For instance, debunking the myth that cholesterol is the cause of America's #1 killer. Well, fortunately, with Dr. Crandal's help, you can get on the right track by finding out just how much plaque is clogging your arteries, whether it's hardened or not, and most important, how to stop, reverse, and cure it. Remember, you can receive a free copy of Dr. Crandal's best-selling book, The Simple Heart Cure, along with free copies of his 3 reports, Sudden Cardiac Death, Don't Be a Victim, What You Must Do to Prevent a Stroke, Alternative Treatments to Protect Your Heart Without Drugs. And this entire heart-saving kit is yours free just for trying a no-risk subscription to Dr. Crandal's monthly advisory letter called Heart Health Report for 15 cents a day. Now, just ahead, you are going to see a big orange button at the bottom of your screen. By clicking on that button, you can start your no-risk subscription and receive your book and the 3 special reports free of charge. But first, let's get back to Dr. Crandal's presentation and learn what else we can do to keep our arteries clean and prevent heart attacks and strokes.
Okay, here are a few more things you can do to keep your arteries healthy and greatly reduce your risk for heart attacks and strokes. Get your hormones checked and balanced. Quit smoking. Walk for 40 to 60 minutes every day. Reduce stress and high blood pressure with prayer, meditation, fun activities, and socializing with friends. None of this is hard except trying to change your diet in a hurry. You may have good reason to change quickly. Many of my patients do, but you'll have more success if you gradually replace bad foods with heart-healthy foods. In my book, The Simple Heart Cure, I offer a 90-day plan. But if you need 120, 150, or even 180 days, that's fine. The important thing is to get on a path to unclogging your arteries now. Of course, just a few small steps toward improving your heart health will greatly improve your overall health, while also reducing your risk for arthritis, diabetes, and cancer. Let me show you what you'll discover in my book and special reports that can literally save your life. And here are just a few of the 20 chapters in The Simple Heart Cure. The 7 hidden risk factors of heart disease. What you must know about chest pain. Women in heart disease, warnings and risk factors. You're having a heart attack. What do you do? 7 steps for living statin-free. Plus these important chapters. Must-have heart tests, 7 superfoods for your heart, keys to reversing heart disease for life, fight heart disease with Dr. Crandal's Life Plan Diet, recipes, 14-day menu, and grocery shopping guide. Next, let me give you a few highlights from my special reports, which contain specific steps to take that just might save your life or the life of someone you love. Sudden cardiac death, don't be a victim. Why an irregular heartbeat is a major concern. The 8 most common warning signs of impending heart attack. How to gauge your personal risk for sudden cardiac death. How to naturally keep your blood from clotting. The best prevention treatments, including lifestyle changes. What you must do to prevent stroke. 90% of strokes are attributed to these 10 lifestyle factors. The 8 conditions that raise stroke danger. The 5 most common risk factors. A critically important early warning sign. Prevention treatments, including easy lifestyle changes. Alternative treatments to protect your heart without drugs. 8 heart-healthy foods that lower blood pressure. Simple doctor's office treatment that cuts risk of repeat heart attacks. How to treat high LDL cholesterol without statin drugs. Why tooth care benefits your health. Natural therapies to prevent diabetes, a heart disease risk, and much more. By the way, each month in my newsletter, Heart Health Report, I report on exactly the kinds of things we've been discussing today. You'll discover simple strategies that can boost your good cholesterol, lower your bad cholesterol, and plump up dangerous type B LDL particles to be more like the larger and safer type A particles. You'll also learn natural ways to reduce inflammation, keep your arteries elastic and smooth, and naturally reduce your blood pressure. A great benefit of following my guidance in Heart Health Report is that all of the things that prevent coronary artery disease also prevent arthritis, diabetes, intestinal disorders, and cancer. It's really pretty simple. Get your arteries and heart healthy, and you'll get your whole body healthy. Not to mention gaining energy, losing weight, and feeling and looking years younger.
We'll get back to Dr. Crandal and the conclusion of his presentation in just a moment. And I think you'll agree this has been a very eye-opening presentation. And what's so exciting is that Dr. Crandal has given us a roadmap to not only unclog our arteries and prevent heart attacks and strokes, but also on how to eliminate or greatly reduce the threat of all degenerative diseases. So it just makes sense to follow the guidance of America's top heart doctor and not be fooled by a misinformed media or drug and food industry advertising. I know I'm going to make some changes, and I hope you will as well, especially when Dr. Crandal makes this so easy to do. And remember, too, that everything Dr. Crandal covered in his presentation today and much more is in his book, The Simple Heart Cure, and also in his 3 special reports: Sudden Cardiac Death, Don't Be a Victim, What You Must Do to Prevent a Stroke, and Alternative Treatments to Protect Your Heart Without Drugs. And again, you'll receive free copies of his book and 3 special reports just for trying a no-risk subscription to Dr. Crandal's monthly advisory letter called Heart Health Report for just 15 cents a day. That's right. You're going to receive 12 issues of his popular monthly newsletter, as well as his 230-page book, The Simple Heart Cure, and those 3 valuable reports for just 15 cents a day. I've read the book and these reports, and I can tell you they're very easy to read, and the heart-healthy practices are easy to adopt. Also, remember, you risk nothing for trying a subscription to Heart Health Report, as Newsmax offers an unconditional 100% money-back guarantee. And of course, you can keep your book and special reports, even if you ask for and receive that full refund. Okay, are you ready to stop plaque in its tracks? Are you ready to reverse your clogged arteries? Ready to reduce the threat of heart attack and stroke? It's easy to do, because at the bottom of your screen, you're going to see a big orange button. Click on that button and start your subscription to Dr. Crandal's Heart Health Report for just 15 cents a day and receive that free book and 3 special reports. That way you can continue to get valuable guidance from America's top heart doctor. And as Dr. Crandal reminds us, get your heart healthy and your whole body will be healthy. All right, let's return to Dr. Crandal as he concludes his presentation. And please note again, the big orange button will remain active at the bottom of your screen for several minutes so that you can click on it at any time to activate this very, very special offer.
Okay, I want to thank you for spending this time with me today. Saving lives is very important to me, and I hope you'll agree I've given you a good start to reversing America's #1 killer. There really is no reason to be one of the 800,000 Americans who die each year of coronary arterial disease, and certainly not one of the 500,000 who die suddenly with no prior warning. But there is no better time to start unclogging your arteries than right now. Please join me and my family of Heart Health Report readers each month and get on the path to stopping and reversing your clogged arteries now. For your lifelong heart health, I'm Dr. Chauncey Crandal.